Thank you for joining us at our first Together on Tuesday event. My name is Sarah Marshall, and I do I do patient and community engagement for the Undiagnosed Diseases Network Foundation. If you have an undiagnosed or ultra-rare disease or care for someone who does, this is a place where you can belong. Welcome to the community. Before we begin, a few housekeeping items. This and all of our Together on Tuesday events will be recorded. So if you ever want to go back and listen or are unable to attend live, or you want to forward the link to someone who might be interested, the link can be found on our website at udnf.org. Our next Together on Tuesday will be on April 2nd. The topic, IEPs and 504 plans, an education primer. Over the years, I have talked to parents and caregivers with questions about how to access school resources and support. As a parent myself of a child with a ultra-rare disease and with professional experience in helping other families access special education, I have even found navigating the education system extremely challenging at times. Come register and be with us together on Tuesday, April 2nd. The link is in the chat. We have heard from so many of you who are eager to find support and resources to help navigate the diagnostic odyssey and even the treatment odyssey. First, I want to personally thank each of you for sharing your stories with me and our new patient navigators. We are honored that you invite and allow us to be a part of your journey. In turn, we hope to create not just a safe space, but also hope to offer resources that you have not yet been connected to or feel support in a way that you haven't yet experienced. Today, we are excited to highlight our newly launched patient navigation program. In the handful of days that this program has existed, we have heard from patients and caregivers across the country and even beyond our borders wanting to participate and wanting support. Michelle Herndon, Director of Patient Navigation, and our patient navigators are here to share their expertise with you and more detail about the pilot program. We know that this pilot program is not going to serve everyone's needs immediately. Our intent is that not only will this program grow, but we also hope to add support programming for patients and families over time. So as you listen today, think about what would be helpful to you. How can the UDNF grow our programming in a way that creates a space where your needs would be met? After Michelle and her team present today, we will open up the floor, so to speak, and invite you to participate by asking us questions about the patient navigation program and also give us feedback on ways we can think about growing our programming. So with that, I am so excited to introduce Michelle Herndon and her team talk about our patient navigation program. Michelle?
Thank you, Sarah. I'm so excited to be here today with all of you, and I'm thankful that we have the ability to record this for people who couldn't be with us today, and for those of you watching in the future, thank you for going to the website and looking for this webinar and watching. I am Michelle Herndon. As Sarah mentioned, I'm the Director of Patient Navigation at the Undiagnosed Diseases Network Foundation. My background is in pediatric nursing. However, personally, I'm the mother of a child who had an undiagnosed disease, went through the Undiagnosed Diseases Network, started at the Baylor site, and after what really is an amazing story that involves fruit flies, the Undiagnosed Diseases Network was able to identify a new gene mutation in him that had never been identified before. And there's so much that's happened since then, and it is just truly my pleasure to be able to support patients and families and help to build this program. So my purpose today is to tell you a little bit about our program as well as patient navigation in general. I wanted to start just what is patient navigation? You keep hearing these words, and what do these words mean? Interestingly, the concept of patient navigation, it started in the cancer patient population, And I really wanted to highlight Dr. Harold Freeman. Dr. Freeman was a surgeon, is a surgeon, and he was working in Harlem, and he realized that his patients who were living in poverty did not have the same outcomes as other patients with cancer. He felt that they were coming to him too late, and he couldn't do anything except cut out what cancer was there. And he really felt like there needed to be some more support for this population in order to provide prevention, early access, early recognition. And he was the president of the American Cancer Society for 1 year. And during that time period, there was a report that came out called the Report to the Nation on Cancer in the Poor. And they found that there were commonly experienced barriers to timely care with the patients and families and providers that they interviewed for this report. And those included financial and access barriers, communication and information barriers, medical system barriers, fear, distrust, and emotional barriers. And I think many of you out there who have experienced a long path to either diagnosis or you are still waiting for a diagnosis can possibly resonate with some of those barriers that you've experienced them, or you have heard of others who experienced them as well. So a very big thank you to Dr. Harold Freeman and his work that then got patient navigation into the cancer world. And then ultimately it moved into more of transitional care. So patients who were going from, an inpatient hospital setting, maybe to a long-term care, or maybe to some type of rehab and navigating that. And then navigation moved into working with more disadvantaged and underserved populations. So you can find patient navigation a lot of places nowadays, not just in cancer, and we're really excited to bring it to our undiagnosed and ultra rare population. So there are 3 levels to what the patient navigator does, and the most important is the individual level. We really want to provide patient-specific interventions and resources, and not just a general, oh, you're undiagnosed, here's a brochure, here's a list of resources. We want to partner with patients and caregivers, really get to know them, really see what their needs are, really see what maybe they have to offer us to learn about them and to learn about what it is like to be undiagnosed or ultra rare. And so we really see this as a relationship and a partnership between the navigator and the patient or caregiver. In addition to that individual level, the navigators have a purpose of collaborating with other patient or other providers on the team. And that can be within the Undiagnosed Diseases Network or without. And then on a systemic level, the navigators and the UDNF, we really want to advocate for system change for our undiagnosed and ultra rare patients. This quote just really kind of resonated with me for what I want to see our navigators doing, assisting patients and families by facilitating access to and coordination among services, as well as providing educational and emotional support. That's a lot of words there, but really we want our navigators to be with patients and families all along the road and to be able to provide vetted, trusted educational and resources to them, as well as providing emotional support. So our patient navigation program, here's where we get into the nuts and bolts of what is actually happening with this program that we've been talking about. We are launching 2 pilot sites this month, February, and those 2 sites are in Houston and St. Louis at Baylor College of Medicine and Washington University School of Medicine. Those are 2 of our current Undiagnosed Diseases Network sites. And our pilot program, where we'll be gathering data, doing program development, trying to learn what works, what doesn't work, learning from the patients, learning from our partners at the sites. We will be providing patient navigation specifically to those new applicants who apply to the Undiagnosed Diseases Network at Baylor or Washington University. We intend to add a few other pilot sites following this model this year so that we can learn from a variety of areas throughout the United States with different patient populations, different providers, different geographical areas. But this will be for new applicants to the UDN. They will be partnered with a patient navigator along their journey. In addition, we know that there are many of you out there who either are already in the Undiagnosed Diseases Network, but are farther along in the process. You've already been assigned to a site, or perhaps you are waiting to see if a site will, take on your case, or perhaps you've had your site visit and you are waiting for results or waiting for a report. And then there are many who are not part of the Undiagnosed Disease Network at all. And we want you to know that we're here for you as well. The programming may be a little bit different than what we're doing in the pilot, but we want to support and provide education and resources to all undiagnosed and ultra rare patients. We have a diverse group of navigators, and you're going to meet them. I'm really excited to introduce them to you. And we are excited to just get moving and start building relationships and start learning what we can do to support you as best we can. So how do you reach us? We up until now, we've really had our website and an email address, but beginning later this week or early next week, there's going to be a specific way on our website that you can reach a patient navigator. You will go to our website, www.udnf.org, and there's a button up at the top that says For Patients. You'll then go to the Patient Navigation Program. So specifically for patient navigation, that's where you'll head. There's going to be a form on there, and it's going to look like this on the left, and you'll enter information, contact information for you. We are partnering with an organization called Unite Us. It's a platform where we can utilize to keep track of our care coordination and the work we're doing with patients, but then it also is a way for us to send secure electronic referrals externally to social support networks throughout the country. Unite Us has partners everywhere in the United States. And when we are partnered with a patient and we know where they live, what their zip code is, we can enter them into Unite Us and find resources from a very, very large variety of social support networks that we can connect them to, whether it's financial assistance for utilities or educational support or childcare or emergency food needs, emergency clothing needs. Unite Us has partnered with these agencies all over the country where we can send a referral and we can be assured that our patients are actually going to hear back from someone. We can have that loop closure there to know that our patients have been connected with those supports. So we're very excited about this partnership. Unite Us is doing great work, and there are so many groups and agencies and opportunities out there that want to support our patients, and we want to make sure that we can connect them. So that's the specifics on how you can reach us. There is still an email. It's info@udnf.org. That would be an email that you would send if you just had a general question about the UDNF, what our mission is, what our goals are. If you'd like to donate, you can sign up for our newsletter that gives you more information. So info@udnf.org is a great way to ask general questions about the Undiagnosed Diseases Network Foundation. But to reach a patient navigator, your best way is going to be to go to what I showed you and fill out this form, how to reach a navigator. For your initial contact with a navigator, this is how you're going to get to us. I'm going to move on.
Can I just insert? Sorry, this is Sarah. I just want to, and I put it in the chat. Oops, I'm sorry. I put it in the chat just now. I just wanted to reiterate that this form is not live yet. So don't go looking for it now because you won't find it. It'll be either later this week or early next week. And actually the best way to know when it does go live is to sign up for our e-newsletter, because it will be announced as soon as it goes live. So that's the best way to be the most up to date.
Yes, e-newsletter or social media. Jennifer later will probably talk about our Facebook group. Those are great ways to find out the most up-to-date information on the UDNF. So thank you, Sarah, for reminding me to let everybody know that this form will be live probably by the early next week. But in the meantime, if you want to reach out to us, you can use that info at udnf.org, and we can put you on a waiting list until this form goes live and we can move forward. So thanks, Sarah. And thanks if anybody asked that question in the chat. Okay, we're going to move forward to more of a Q&A kind of panel session with some guests that I've invited. And I think that what's really important for you all is we really would like your input. So if you can be putting questions in the chat, or if you can be thinking about a question that you might want to ask later, we are going to have a question and answer time at the end where you'll be able to come off mute and you can ask any questions that pop up during this time. So for our next section, I'm going to invite Jill Mokry and Kathy Cisco to turn their cameras on as well. They are both site coordinators at the Undiagnosed Diseases Network at our pilot sites that I mentioned we are launching this month at Baylor College of Medicine and Washington University in St. Louis. So thank you, Jill and Kathy, for being here. I'm so excited to have you. I'm so excited we get to partner with you. So let's just really quickly, can you introduce yourself and just explain what your role as a site coordinator is with the UDN and how long you've been in your role? And I'm just going to go with Jill because her camera is right next to mine.
Hi, everybody. Yeah, I'm Jill Mokry. I am a genetic counselor and associate professor here at Baylor College of Medicine. I have been with the UDN here since almost its start. When it started, we started seeing patients in 2015, and I was already part of the team then. And now as we go into phase 3, I'm actually a co-principal investigator on the study. But as a coordinator, you know, I am the main contact for a lot of applicants and patients interested in the study, and just trying to kind of keep everything moving through the process as we see patients and keeping patients informed about results and follow up from their visits here.
Great, thank you. Kathy?
Hi, everybody. I'm Kathy Cisco. So I am a nurse practitioner. I'm a pediatric nurse practitioner at WashU here in St. Louis. We joined the UDN during phase 2, so we weren't one of the original sites, but we did join in the second phase, and I was with them at the beginning of that. I helped coordinate all the visits kind of from the beginning all through the end. So we triage our cases as they come in, review them as a group, and then once the families are accepted, then I arrange all of their visits, coordinate their travel to St. Louis, and then work on follow-up, and really, you know, help the families kind of navigate that whole system.
Great, thank you. Having personally gone through the UDN, I can tell you all that these site coordinators and their teams, you know, are amazing. They work super hard. They care about their patients, but they also are taking care of like patients who are there, like in person, and who are coming for a visit. And as much as they wish they could, you know, immediately respond to things, it's not possible for them to do it all as much as we all think we can do it all. And so we really just want to share that this navigator program is supplementing the amazing work that the site coordinators and the site teams are doing. During this pilot phase, we're really working closely with Jill and Kathy and their teams to see, you know, what kind of synergy can we create between the navigators and the sites to just make the experience better overall. So it really is a partnership during this pilot where we really are learning together. So we'll start with Kathy on this one, and then we can go to Jill afterwards. In your time that you've been at the UDN, what have you seen in regards to your patients and their experience that you think the patient navigator program might be able to help with?
So the families really, from my perspective, they need a lot of emotional support, and they need a lot of not really physical support, but they need just the managing of everything. So am I seeing the right physician? Is this person an expert in this area? And then what does all this testing mean? Everybody's talking about different types of testing. So I think just the kind of getting down into the nitty gritty and really talking with the families and making sure they understand what all the providers are talking about. And then just the ongoing emotional support, I think for me has just been very eye-opening. I mean, they need a lot of help. And after, I always tell families, when you leave at the end of your evaluation, when you leave that week, that's the beginning. So don't feel like because you're not going to leave with all your answers. So this is the beginning, and we're not going to just see you that week and then never talk to you again. You know, that's almost the beginning of our relationship. So the follow-up and just making sure that families know that we haven't forgotten about them and we're still doing studies. You know, the research takes so much time, and I think it's hard for families to not become discouraged that people haven't forgotten about them, or you know, that we aren't just working with them anymore. So I think it's important to really have a good relationship with them and really let them know that somebody hasn't forgotten about them.
Great, thank you. Yeah, Jill, if you have anything to add to that, or, you know, maybe you could share, what are you excited about participating in the pilot? Like what do you hope to see come out of this pilot and the partnership with the UDNF and the Baylor site?
Yeah, I think Kathy made some really good points about what the UDNF is going to have to offer the families. I'll just add, you know, as much as we would like to think that our processes that we have to apply to the UDN and participate in the UDN are a breeze, sometimes, you know, they're hard because there's so much responsibilities that families are dealing with when you have a family member with a rare disease, and to have that extra support from the UDNF. To help people through the process of even applying to the study and helping get medical records and things like that will be really, really great. You know, these are all things that we wish that we could do, you know, at the clinical sites, but we have limited kind of bandwidth. And so having that extra support from the UDNF to service our families, you know, I'm really excited that they will have that, you know, and the fact that it's not just about the UDN processes, that they're there to also provide resources for just other supports that might, or other needs that the families might have. I'm really grateful that UDNF is stepping up to provide those.
Yeah, that's a great point. You know, for people who may not be familiar with the process of the Undiagnosed Diseases Network, it is a research project at its heart. It is nature, and there are times when people apply to the UDN and for various reasons are not accepted into the program. And we at the UDNF with the Patient Navigator program want to be able to continue to support them. Even if maybe they're not a great fit for the UDN, they still need support and resources and help. And we intend to continue to follow patients who perhaps end up not being UDN participants. Maybe they're exploring it, but then they don't apply, or they're not part of the program. You know, we really want to build our program to support everybody. So while we are talking to two of our pilot site coordinators here, I do want to reiterate that our ultimate goal is to support patients who are in the Undiagnosed Diseases Network and patients who are not as well. So let me just take a really quick second to just say a very big thank you to Jill and Kathy and the PIs at their sites and their teams, Baylor, Washington University, just really excited for the support and the partnership, and can't wait to see how the pilot works. So thank you both for being here. Okay, for our next intro, it is my pleasure to bring in one of our patient navigators. Kristen, if you want to go ahead and put your camera on. Hello there. This is Kristen, and I am excited to introduce her. She and I have very similar stories, and we both are parents of patients who went through the Undiagnosed Diseases Network. In addition, we are also both pediatric nurses. So we have this perspective of being a parent and being a professional in the space. So Kristen, I just shared a little bit about you, but who are you? What brought you to want to be a patient navigator at the UDNF?
Thanks, Michelle. Hello, I'm Kristen. By trade, as Michelle kind of mentioned, I'm a certified pediatric nurse. But But what ultimately led me down the path of the UDNF was, as Michelle mentioned, my son was accepted to the Duke site as a patient. So he is considered partially diagnosed. So we still have an undiagnosed section of his disease process that we work daily to try to figure that part out. As he got accepted to Duke, I was invited to apply for the peer group, which was part of the UDN. Was on that for going on 2 years, and that's what really sparked my passion. Was I think the underlying advocacy work and the passion that I had from nursing to help. So when I moved to rural Louisiana, I saw that need even more, that the resources in healthcare and physicians is just not as big. So then when the opportunity came as to join the team of the UDNF as a navigator, those passions merged, and that's what got me here.
Great. Can you describe your experience with the UDN from, applying to kind of where you're at now?
Yes, definitely. And mine's not going to be like everybody else's. Everybody has their own story, which that's what makes us all unique. I feel like at the time where we heard about the UDN, which I had never heard about, even being in the medical field, I was given hope again. That word's very big. I was tired of fighting the healthcare system. I was tired of trying to find answers on my own for my son. And then once that application process came, I had a great team that helped me fill it out as local hospital. Once again, privileged. It's not like that for everybody. And then when I got the email and it was like, oh, there's the hope. There's what I needed, that extra strength to continue. So my whole process from beginning, and we don't have an end. I don't see an end anywhere close, I know, because of research. But the UDN and the team at Duke has been nothing but amazing. Where I felt that there could have been a need was, as a mom, you push and push and push. You get tired. You get tired of fighting. And that's where I saw that a navigator could really help escalate our whole foundation, our whole the undiagnosed diseases network as well. So I think being that person and being the one that can be there emotionally, physically, and not feel like as a parent, I always felt like I was a burden when I emailed. Am I bothering them, or is this a stupid question? Even though I'm in nursing, I still want to know the answer. So I think putting the navigator role into the equation is going to help the communication across everything, and actually give the support back to the families that need them and the patients.
Thanks. Yeah, I think you and I, we both had really positive experiences with our, kind of timeline and our entry into the UDN and everything that kind of happened along the way. I had great communication. I obviously at the end I came out with a diagnosis, which does not always happen, despite really diligent and really smart researchers. And I've had experience working, at the WashU site here in St. Louis, meeting some of the families and, hearing just their experiences. And so, we've had really great positive experiences. I guess, what do you think with your positive experience, what made you realize, maybe others aren't having as positive of an experience?
I think that came across when I was on peer. I saw that not everybody was having the same experience as I was, and there were a lot of frustrations. And as a nurse in a background, that's hard to hear. That's hard to hear when you have so much belief in one system. Like you want to be able to reach out to them and say, hey, let's fix this. So I think that's when it became apparent that everybody wasn't going to have the same experience as me. And I think it was eye-opening as well, because even though I'm a nurse by trade, I had to be humbled and reminded that everybody's different. Everybody's different. Every patient's different. We're working with the most unique of unique patients, and that causes its own barriers. So I think that's when the realization came, and when it was like, when I saw the navigator position, I was like, oh, this is it. This is it. This is where my worlds meet, and we're going to do amazing things.
Yeah, I think it's always amazing, yes, we're all unique, but as I meet more and more, I mean, for example, more and more moms, not everyone in the UDN is a child. We have adult participants as well, but I resonate a lot with moms, and so many of the things they say, I'm like, yes, yes, a lot of us felt like our doctors were kind of, dismissive at times, like, oh, that's nothing, or that maybe we were raising red flags and we weren't being listened to. And so there are some universal themes and, some differences as well. Like you, I found myself just feeling like a burden, asking questions and, staying up late at night doing Google searches and journal searches, and realizing that, I had the privilege of a nursing degree, and I could read these journal articles with really big words and stuff, and understand, this much of it, and all of our patients should have access to this research, and someone who can, help them interpret it and find it, and learn more. And so I just think there's so much potential for how the navigators can partner with patients and caregivers. And like you, I'm super excited. So thanks, Kristen. Okay, Kristen's going to join us again later, but now I'm going to bring in two more navigators. We have Mary and Jennifer, and they are going to come on camera. There they are.
There we go.
Hello. Okay. So while Kristen and I, had experience with the UDN, we'd gone through the process. Jennifer and Mary have not been through the UDN, however, have a lifetime of experience being either a rare patient or a caregiver to a rare child. And so they bring their own unique perspective in. And so I'm excited to have them, and I'd love for you to briefly introduce yourself and share what you thought you would bring to the UDNF as a patient navigator and why it was a good fit for you. So Jennifer, you can go first.
Hi, yes, I'm Jennifer Tussaud, one of patient navigators, and I am really excited to be here. A little bit about me. I got into this world of rare diseases over 10 years ago when my son was diagnosed at age 2 with a rare autoinflammatory disease. And at the time, I was kind of the obsessive parent that was reading all the literature. I had read every study as few of them there were at the time on his condition, but that didn't tell me how to live with it. It didn't tell me the day-to-day questions that came up. So I knew I had to go find the other people with the same condition who could teach me that. So that led to me this very small, brand new Facebook group run by the Autoinflammatory Alliance. And I just kind of dove in. People asked questions. I knew how to find the literature. I'm really good at translating the literature into plain language so that we can all understand it. So it kind of became partly my therapy to be able to help other people. And from that, I ended up joining the Autoinflammatory Alliance Board of Directors. And with that, I've grown that tiny little Facebook group of a few dozen people to a few thousand. I really enjoy providing one-on-one support to every individual that comes to us, whether it's through the community groups or through emails or other avenues they find us, and providing whatever support they need. I've learned by working directly with the patients what the resources are that they need, how to prepare for doctor's appointments, how to find and apply to the research studies. And I've listened and learned from the patients what barriers to care there are and what research needs are. And from that, I've been able to act as a liaison and patient advocate in various working groups and co-authored patient-centered research. And when I saw the job posting for the UDNF, I was like, I have to do that. I'm really excited to be able to bring all those experiences to a broader community and also learn from this community.
Thank you. Mary?
Hi, I'm Mary Morlino, and I'm a patient living with sarcoidosis. And for me, part of the route that I came to here was through that experience. In addition to my own, I have nephews who have muscular dystrophy, and so I've had this rare disease and undiagnosed process in my life for quite a while. I personally had a 7-year diagnostic odyssey, which, the journey that it takes from the first time of being ill to getting a diagnosis. And as other people have mentioned, it's just the beginning. So I know what that experience is like. Before I worked at UDNF, I worked at most recently at Global Genes, and that's an organization that supports the rare disease community in a variety of different ways. And I was part of the team that built out the Rare Concierge program, which helps to get people connected to different resources that they need. And one of the main things that I've noticed and through my own experience is that people don't know what they don't know. And I really wanted to bring my own personal experience and be able to help guide people and support people on their path, because it's one of those things that it's very efficient in a way, and that sounds like maybe not the right word, but just be able to use the knowledge I have to help people get to where they need to go and access the information. So that was part of the Rare Concierge program. Before then, I worked at the EveryLife Foundation for Rare Diseases, where I was involved in the organization, and what the EveryLife Foundation does is they focus on legislation and policy for the rare disease community, really digging down and working for change in the way that the medical systems are, the rare disease patient experience, and really trying to be active in that change. And I learned a lot through that process of all the different types of ways that people can be an advocate and advocate for their disease or for the rare disease community, for the undiagnosed and the ultra rare. And so I have all these experiences that, similar to the other navigators have said, you come from this background, and in a sense you have your backpack of skills, and I want to be able to use those skills and experiences to support other people on their journey so that they can, speed up their time to diagnosis, know that they are not alone, and that there's people out there who understand what they're going through. So that is, when I saw the information about this position as well, I was just really excited, because the part of my experience that really stuck out the longest, or not the longest, but the strongest for me, was that diagnostic process. I couldn't understand for the life of me why, I had these symptoms, and that there was no answer, because you always think that someone's going to have an answer. And with multiple doctors over the years saying, yeah, I don't know what to tell you. And, a full spectrum of responses. That's what I knew, that for the UDNF, I'm like, this is the place where I feel that I can bring my skill sets, my passion and my caring, and my desire to support people together. So I'm so happy to be part of this team. And it's, in my opinion, it's great because we have such a varied background, but we're all aligned on the same mission. So that's one of the key things for me.
Yeah. Well, we are happy to have both of you as well in your experience. This is going to maybe be hard to narrow down, but as a patient with a rare disease and a caregiver of a child with a rare disease, in addition to, both of you have many, many years of relationships with people in the rare community. What in the navigation program do you really want to make sure that we provide to the community? Like, what are you most excited about providing?
I'll go. My thing I would say is that the hope that there are other opportunities, and that what you're focusing on and what you care about is that there's other people there for you. So I think it's that's really, I don't want people to give up. I want people to know that there's no dead ends, and that we'll keep moving forward to try to help you. And also that any efforts that are made towards your diagnostic process, you're contributing to a much larger community by what is learned through your experience. So through that, the hope for the individual and for the whole community.
Okay. Jennifer?
Yeah, well, I'll agree with the hope for sure. I think for what me is, I know that navigating this world with undiagnosed or an ultra rare disease, there's stress of dealing with the healthcare system, stress of dealing work in school, stress of trying to learn the medical lingo when you may not have any background in that. But there's additional stress of traveling, across the country to find that one doctor that might know your condition. And I just know how overwhelming and how much stress that could be, and just feels like a physical weight on your shoulders. And I want to be able to, through the navigation program, lift some of that weight so that, we can take on some of your stress for you, help you navigate some of these, answer questions, to prepare for appointments or find the research studies or go through the UDN. And, hopefully with some of that weight lifted, then you can feel more empowered to keep going through that diagnostic process, get into effective treatment, which is ultimately the goal, I think, for everyone.
That's great. Yeah, both of you, really resonated with me. Like the word that just sticks in my head, and it doesn't make any sense from a practical perspective. During my son's, 7 to 8 year journey from, being totally healthy to ultimately passing away from this super ultra rare disease, I had compassionate doctors taking care of us, nurses at the hospital that, I actually worked at the hospital where he was taken care of. We have an amazing church community. I have a family that was supporting the heck out of us. But why did I feel alone? That's just how I felt. Not anyone's fault. That was just the feeling that I had, that no one understood what I was going through. And I just am so excited that maybe more people out there won't feel alone, because they know I have this navigator I can call, who I know knows me, gets me, remembers that I'm out here, and just, I want people to not feel alone. So
Yeah,
thank you both. Go ahead.
I just want to add in about our Facebook group, Michelle.
Oh, yes.
One of the key things for me was, because my son has an ultra rare disease, is finding those other people. And we did that through Facebook groups. And I've now found hundreds of others with his condition. So we at the UDNF have also opened up a Facebook group that can help with those connections, help with support and resources. So we're inviting everybody. If you have an undiagnosed or an ultra rare disease, please come join us. I will put the link in the chat. But if you go on Facebook and search for UDNF undiagnosed and ultra rare community, you should be able to find it also.
Thank you, Jennifer. She's our moderator extraordinaire on our Facebook page. So, okay, I'm excited to bring our last two navigators in. Jennifer and Mary will join us again in a moment. But for now, it's Dana and Ronisha can come on camera, and the last grilling of questions will be directed at you two. I see Dana waiting on Ronisha. I love that all of you could be here today. Hello there, Ronisha is. Okay, so I'm gonna go ahead, and the reason I brought Dana and Ronisha in last in our group is these two actually have experience with care navigation, care coordination, and bringing them into our team was huge. I have 18 years of pediatric nursing, but that's not the same as care navigation and care coordination. So their expertise is huge for our team. So glad they're here. Let's start with Dana, and if you could briefly introduce yourself, describe your experience, and why you thought the UDNF Navigator was for you.
Hi, everyone. My name is Dana, and I'm so happy to be here. A little bit about me. I bring nearly a decade of law enforcement experience where I held many different roles, to include my favorite as a community resource officer. I then transitioned into the remote oncology and mental health spaces, where I noticed that I flourished the most in patient-facing roles. And my passion truly lies in addressing population health disparities, and eliminating barriers to care. I had to witness a very close friend of mine who is like a sister to me endure a 7-year diagnostic odyssey, which drastically altered her life, which in turn deeply impacted me. That experience truly fueled my dedication to helping others, which led me to the UDNF Navigator program. And honestly, it was truly a natural fit for me. I really love the challenge, but more so the opportunity to make a meaningful difference in the lives of those facing undiagnosed and rare diseases.
Great. Ronisha?
Hi, everyone. My name is Renisha Williams. I am a patient navigator. I bring about 7 to 8 years of experience as a patient navigator. I have previously worked at Aetna. I've worked at United Healthcare. I've done a little bit of work at Johns Hopkins and Inova Hospital. I'm just doing patient-facing roles. I really enjoy just kind of providing resources to patients. I feel like regardless of what a patient is experiencing, whether it's mental health, whether it's a rare disease, I feel that resources are just important for everyone to know. I feel like there's so many resources out there that a lot of families don't know about. And so I kind of strive to just find those resources that are free and that can be beneficial to families. Just because I know healthcare is such a struggle to even get the littlest bit of help. And so I am super excited to be here. I don't really have a lot of background with the underdiagnosed and rare disease, but I'm very excited to kind of just become more familiar with it and just learn more about it. I feel like I've learned so much just by hearing everyone else's experience working with the community. And I'm super excited to just join and kind of learn more about that population.
Great. I mean, that leads to maybe the next question, and Ronisha, you can start. Is there anything since you've been with the UDNF that you have learned that maybe you didn't know about undiagnosed or ultra rare patients?
Just the fact that there's so many different diseases that I guess can be categorized as underdiagnosed. I just kind of didn't know the different ones. And also I know when we were on our call yesterday, when Jennifer had kind of mentioned the lingo and the language, I just didn't know the verbiage that a lot of underdiagnosed and rare disease patients use, such as journey and stuff, and just kind of being familiar with what can be a trigger to people. I think that was also very helpful. But yeah, I'm really excited to just kind of learn more about it as a whole.
Yeah. Dana, what about you? Have you learned anything or been surprised by anything about rare or undiagnosed patients that you've learned?
Yes, so much, but the most fascinating concept to me is the zebra concept. The way I understood it is spotting a zebra among the horses. And I guess there's a saying that if you hear the hoofbeats, think horses, not zebras, but it implies that a common diagnosis is more likely than a rare one. However, in rare disease cases, those zebras can surprise us. So it's just a reminder for medical professionals to remain open-minded when they're facing unusual symptoms that don't fit a typical pattern. So that was incredibly fascinating to me.
Okay, well, I expect to start seeing some zebra things in your wardrobe. Okay, last question for Dana, and then we'll bring everybody back for some question time at the end. Dana, you are a bilingual patient navigator. You speak Spanish, and we're excited for you to be able to partner with our Spanish-speaking patients and inquiries who would like a Spanish-speaking navigator. What are some key components, or why do you think it's important to have a navigator that can speak the language of the patients that they're working with?
I personally believe it's crucial for patient navigators to communicate directly with patients in their language, not only because it fosters trust, but it also ensures accurate information exchange and it addresses those cultural nuances effectively. And in turn, this direct communication helps build rapport and it enhances the patient's experiences and overall health outcomes.
Yeah, great. So we are excited about that. We do intend to hire more bilingual navigators in the future, but we also have contracted with a translation service or an interpreter service, excuse me, an interpreter service that we can do video meetings with or phone calls with. And so we are excited to be able to have that accessibility to patients who speak languages other than English. So thank you, Dana. Ronisha, you can stay on camera and we're going to invite everybody else to come back on. And Sarah Marshall is going to lead our question session. If there's any questions from the chat or anybody who sent questions privately or just anything you would like to ask, you can raise your hand. And I think Sarah is going to call on people. So I'll let Sarah take it away.
Unmute myself. All right. So I just see 5 people. I don't know if Sarah, there's another Sarah. She's our technical person. So if she sees a hand up that I'm not seeing, you can go ahead and unmute. I'm not seeing anything at the moment, but I have had a couple of questions, particularly over the last couple of weeks, because I'm actually one of the moderators on the UDN family Facebook group. And so one of the questions that I've received is what types of, are there specific types of like financial resources that the navigators can connect families to? How does that work? I know you talked about Unite. Maybe you could talk a little bit more about how that service works. Michelle?
Sure, I can answer that quickly, and then after me, Christine McGarvey has a question, so we'll let her go. Just quickly, Unitas can link you to all kinds of resources, but the really key thing about Unitas is after we've met with you, created your profile, found out some pretty basic information, we will be able to search and see if these resources actually apply to you. I'm not sure how many of you out there are familiar with going online, searching for grants, searching for scholarship programs, searching for programs and applying and then finding out you don't qualify. And we want to save patients and caregivers that time, and Unitas helps us to know how to match them with programs that they actually could qualify for. So that saves some time and energy for the patients and families, that the navigators can provide them resources that they actually could receive.
Right. Christine McGarvey, did you have a question?
Yeah, I just had a question. So I'm undiagnosed. My daughter's undiagnosed, and recently my mom's undiagnosed. And I was just wondering if you had any suggestions or strategies for not feeling completely overwhelmed at managing multiple people's medical care. Currently, right now, I'm coordinating medical care with 21 physicians. So a little bit overwhelming.
Do any of the navigators want to take that? I have.
I
I'll
think I
start.
could.
Or go ahead. Go ahead.
So Christine, I only spoke of my son, but we have things throughout the entire family, and some of it pieces are also undiagnosed because genetics are not black and white all the time. There's gray areas. So I'm also coordinating care between my 2 kids and then trying to coordinate care for myself. I think the biggest thing for me is finding that community and finding, I found friends through the Facebook group, and then also, we end up meeting in person and chatting, texting, and really just having those other people who really know what you're going through. So if you haven't found that community, I do definitely invite you to the Facebook group. And I found, that community can help take some of that weight off the shoulders of, trying to figure out how to get ready for appointments and things like that. Just, tips and tricks that make it easier. Like I have a standardized form basically now when I'm going to brand new doctors that I just can update it and fill it in, and just makes it easier to prepare for those big appointments.
I have my thoughts on this initially is, wow, you're doing great with everything you're doing by just, attending something like this, and the work that you're doing, trying to coordinate all of what you're you're trying to balance. And so one of my recommendations would be to give yourself grace and have compassion for yourself, where you were just thrown into the deep end of the ocean, and there's a lot to navigate, and it's okay that you don't know everything all at once, and that there's so much unknown. You're not sure how you're going to be able to do it at all. But to be gentle and have compassion for yourself, because you're doing great. You really are. And just the fact that you've reached out. So just remember to just be very kind to yourself and know that there is assistance and support out there.
I think the other thing that I would add to Christine is where you can, and I think that's, for me, this has been true. And, when I've talked to other undiagnosed or rare disease or ultra rare disease caregivers, is finding routine every day. That routine, I believe routine is a part of self-care, and especially with so many different moving pieces that you have in particular, I'm sure routine is probably hard to come by because things come up and you have to, go run to this doctor's appointment or go get these medical records. But if there's just, some time in the day when you wake up or when you get ready in the morning, and just attending to the things that are routine and give you comfort, because I think a lot of times routine gives people comfort. So whether that's using a certain shampoo in the morning because you like the way that it smells, or just making sure you have certain foods in play, foods at hand that that feel good to you, or and the clothing that you wear, just anything that that can kind of appeal to your senses and make you feel good, just for a little bit of time, provide comfort day to day, I think can be really helpful.
Christine, I just have something else to add to that. And I'll make it short. I know a lot of us have gone so far, but if you have a patient navigator or a case manager available to you, I think that could really lift some of that weight, some of that burden that you're possibly feeling. It does take time to build that trust with someone and let them coordinate care on your behalf, sort of like orchestrating seamless, appointments, scheduling, facilitating the paperwork completion, obtaining those medical records on your behalf, just really leaning in on your medical community as well. That way you're not the one having to call the 21 physicians. One of us can do that for you. So something along those lines, I think that would really help lift that weight.
Christine, thank you for sharing that question and being vulnerable with everybody. I really appreciate that. I don't want to cut off the discussion, but Sarah, there is a question from Daphne, if we want to get her question before we end.
Sure, we'll do one more question, and I'll just, we've reached the hour time. We'll go to Daphne's question, and then if there are further questions, please email the info@udnf.org. And again, that page will be up live the end of this week or early next week. So Daphne, go ahead.
Hey, Sarah. Hey, Michelle. I had met you guys both out at the Global Genes Conference out in
Yes.
San Diego. My daughter was just diagnosed with tub-4A leukodystrophy at the end of July, and I'm still navigating, what that is and what that looks like. There's currently, no treatment and no cure. I'm located in Southern Illinois, so not too far from you, Michelle. Would I still be a candidate to collect what resources are available? I am trying to empower this community and learn, but I am so new to this ultra rare disease world. I think that I could definitely benefit from some assistance, and then be able to cascade that down to the 180 families that I know of that have a kid with tub-4A.
Yes, thank you for asking your question. And I do remember meeting you, and that this ultra rare world is definitely something none of us are prepared for.
No.
And you just dove right in, and I just want to honor the work that you're doing and supporting your daughter and this community. Yes, so even though you're not part of the UDN, even though you know have a diagnosis, you know what we intend to do is the ultra rare community. The navigators want to help you build your community, and so we can provide support on how to get that community going, what support is out there, and specifically for you with leukodystrophy, I mean, I'd love to connect with you and share some resources that I'm familiar with. So yes, we definitely can help you as well. So I can, if you want to email us at the info@udnf.org, I'm happy to get back to you.
Okay, thanks so much.
And thank you for joining us, Daphne. I also very much remember you. So, and that's the great thing too about building this community is, being connected with each other, feeling support, and really getting to know each other in a way that the undiagnosed and ultra rare community has known each other in the past. So that is it for today. Thank you so much for joining us. Contact us at info@udnf.org, join our Facebook group, and we look forward to seeing you next time at Together on Tuesday.